Hi, this is Paul Wise and welcome to the Lawn Vet video series. In this short video I'm going to be sharing some information about having a cat spayed. The main reason for recommending spaying in female cats is to prevent reproduction and unwanted litters. There may be also some advantages such as reducing the likelihood of the transmission of feline leukemia and feline immunodeficiency viral infections through sexual contact. In the bitch it's well known that spaying early provides a lot of protection against the development of breast cancer. The same is likely in cats too. There is no behavioural, medical or scientific reason for letting your cat have a litter before she is spayed. Once the cat reaches puberty, usually at around 5 to 7 months of age, though there can be some variation, she would likely have a heat or estrous cycle every 3 weeks or so for most of the year, unless she becomes pregnant. She will be in heat or receptive to mating for approximately 1 week each cycle. During a heat, she may display unsociable behaviour such as loud and persistent crying and frequent rubbing and rolling on the floor. This behaviour, coupled with her scent, will attract male cats from miles around. Removal of the ovaries will stop her estrous cycles. When should you have your cat spayed? Well, routinely most cats are spayed at between 5 and 6 months of age. What does spay surgery involve? The operation is performed under a general anaesthetic through a relatively small incision made most commonly in the left flank or, in the case of older or pregnant cats, through a midline approach, typically just below the umbilicus. Both ovaries are removed along with the entire uterus. In general, complications are very rare during an ovarian hysterectomy surgery. However, as with any anaesthetic or surgical procedure, there is always a small risk. After surgery, cats usually recover from the new operation remarkably quickly. They may be a little drowsy for a few hours, but by the next day they are usually very lively again. It's sensible to try and keep your cat fairly quiet for a day or two to allow the internal wounds some time to heal. Your cat may require a bust guard to prevent any licking at the operation site. As always, if, having watched this video, you have any questions, or if you encounter any difficulties, then please phone or email the surgery. We're here to personally help give you the very best advice and treatment possible for your much loved pet. Thanks for watching. Any feedback regarding this video would be very much appreciated.